Thank you for your audience. So they call me Mr. Anti-Filler. So normally you see in most commercial congresses that anybody speaks hyaluronic acid. It's really boring. So finally you will find in me like you have some, like say, Dr. Jekyll who speaks about the good things about fillers, and together, and today I will play Mr. Hyde against fillers so that you see what I think about. So that's a common complication just to begin for the menu, but you will see much more worse. And I want to tell you what happens exactly in the evolution of fillers. If you see, in the year 2000, normally the collagen had really a big impact, and the hyaluronic acid was quite not existing. And in 2008, you can see that hyaluronic acid is really the main used filler, and the other ones, really even fat grafting, which is the safest one, is not so much used. Even it's really safe. Why that? Because in commercial congresses, which are the most in the world, unfortunately, they place in the head of doctors that the fillers are really good. They don't like people who will speak about fat grafting. That's the safest. They will even avoid them, not invite them. And that is really a big problem. What are mostly these complications of fillers? They are minor and major. But what interests me today are the major complications, which can, of course, lead a medical doctor to a lawsuit at the court, things we have really to avoid. And I will really insist a lot about nodule necrosis, granulomas, and late edema, because these are minors, so it's not a big problem. So, and this complication can be mostly locals and chronic, like nodules, granulomas, and migration, that you have mostly to try to treat them. I say to try, because mostly you cannot treat especially some kind of granulomas. It was a Brazilian publication, a thesis of plastic surgery, about 9 years ago, from a Brazilian plastic surgeon, but it was written in Portuguese, so Angelo Rebelo could help us. And it demonstrates that with, for example, polymetacrylate, dimethylsiloxane, metacrylate, and even Restylane, you had all animals who died. So in such case, you cannot say that the not permanent fillers are better than permanent fillers. For me, you have exactly the same complication, but at different rates, and they appear at different moments. It's only that. So, what are for me fillers? Fillers are for me silent killers and medical thrillers. That's what I am saying. Of course, the first big massive killer was Adolf Hitler. The second is AIDS. And the third are fillers, of course. And here, it's what you could see. You see about such a complication. They can call me, thanks to my friends, of course, who have given me some pictures. I have many, many friends. I call that Madame Tussaud of complication of fillers. You have to be very careful about publications. Normally, I don't like to publish because for me there are two kinds of doctors, or the doctors with blood on their hands, like me, or the doctors with ink on their hands. So I am the kind with blood on their hands. And you see, in case of lipodystrophy for HIV positive people, for example, metacrylates or acrylates, which are really the unsafest one, you will have why good results, because these people will die for their illness of AIDS before the complication of filler will appear. That's why you have very good result in such case. So now when you have a filler, you should, especially in the face, how you should follow it and how you need to have a critic spirit. If you make an ultrasonography of 20 megahertz, you can really see the epidermis, the dermis, and hypodermis. But if the companies show you some ultrasonography 7.5 megahertz, the interpretation can be what you wish and what you want or what the company wants to sell it better. So here it's a 20 megahertz and the only one I will retain, and normally a very good filler, and when you have this homogeneous width inside the dermis that you can see at ultrasonography. So normally when you have a complication of filler and you are to the court, and I am an expert for that, who is the responsible? The product, the physician, the patient, the notified body? First, I would say the bad copies made in the worst countries like Ecuador, South Korea, Argentina, Venezuela, Brazil, China, and India. Sorry if I have maybe not mentioned one of your country. But I want nobody jealous. So, what is the difference between nodules and granulomas? It's very important to know, because for the nodules, the diagnosis, you see here it's histologic, but you will never make to your patient, especially who is much more a client, a biopsy to know if it is nodule or granuloma. It's better to make a diagnosis, but which is not sure completely, by clinic and not by histology to avoid any scar. So the nodules and granulomas, why it's very important to make the difference? Because for nodules it's always the doctor who is responsible of this complication, but the prognostic is really good, because just with a surgical resection, anything will be okay. But in case of granulomas, never make surgery, and then who is responsible can be the product, mostly, the doctor also, the patient who are really potential liars, who never say the truth, and also the notified body, like CE. And that CE doesn't mean that it is safe. It can mean also European corruption. So, the generalities. Like I say, the nodules are always a technical error with good prognostic, because with surgery you will resolve anything. And with the granulomas, which is only medical treatment, mostly there is bad prognostic with patient liars, chemical mistakes, and even technical errors from the doctor. How you can make the differentiation between nodules and granuloma? Normally, clinically, the nodule is only one. It's difficult to find a lot of them. And the size is stable. They also have a border confined by a fibrous capsula. And also they are, regarding them, there is no edema and the skin is quite normal. For that, only surgery, never corticoids. But for the granulomas, they appear in a lot of number at the same moment. Suddenly, they can grow also of volume. They will never be bordered by a capsula. And also regarding them, upon them, you will find some edema with some skin discoloration. The treatment is only medical. First using corticoids, after, if it doesn't work, 5-fluorouracil antimitotics, and sometimes even both, it will not work. That's what I say, tentative or treatment. So for the histology, you can see the difference between the nodule with a capsula and here the granuloma. Why you have that? Because for the nodule, there are 5 mechanisms to get it, or inadequate quantity of injected material, or product placed too superficially, or lack of proper distribution of the filler, organized hematoma with calcification, or application in inappropriate plant or layer. And for the granulomas, mostly 3 mechanisms: foreign bodies in the injected material, microspheres too small. You can see that for these 2 things, it is because of the product. Here, not. That's also very important. And the pathological biofilm, which is also not new for most of us. But you have to know that why you have granulomas, because there are some correlation that if you inject any kind of filler, or you mix different fillers, you mix, for example, 2 different hyaluronic acid of 2 different companies, you are sure to get your granuloma, 90% of chance, in the same location. Or if you are injected also a filler just after, at the moment of facelift operation, you will get your granuloma. Be careful also, because I am facial plastic, open always the mouth of your patient, because if you inject a filler and he has a parodontosis of a dental focus, dental infection, you have much more chance to get your granuloma, even if you make fat grafting. And of course, aesthetic medicine doctors will get much more granulomas than us, because they make mesotherapy, mostly, what normally I never do, because I don't trust in such kind of sadomasochistic therapy, but it's my point of view. So the tentative of granulomas, how you try also to treat that. Here it's a formula. It's a lot of them have a formula. That's what I am mostly using. Okay? And I explain to you why, and also for the court, what can happen. You can see that for hyaluronic acid, here HA, the rate of complication is the lowest, but they appear quite immediately, or not so long time after you have made the injection. For polylactic acid, the rate of complication is higher, okay? And you can see also here for polymetacrylate, the rate of complication is very high, but they appear very, very far away from the injection, mostly 5 or 6 years or even 10 years after the injection. In many countries, you have only 5 years to make a lawsuit to your doctor after your injection. But if they appear more than 5 years after, of course, you cannot make any kind of lawsuit, even against the company. That's why you can find still a lot of them on the market, CE approved and FDA approved. So, let's begin with the collagen, which is resorbable. Like I said, all kinds of fillers will give granulomas and also necrosis and also nodules. Here you see that with collagen you find here some necrosis. You can find also some nodules. With hyaluronic acid, that's a colleague of us from Mexico. He has got such granulomas after hyaluronic acid injection. I will not mention the product. This is well known. That's from Dr. Wist from Germany. Here, sulconasogeneal nasolabial furrow with granuloma after hyaluronic acid. Here again, after hyaluronic acid. So you can see that hyaluronic acid is not so safe as we could imagine. Here, edema 9 months persisting after hyaluronic acid. This one too. And also, you should never put hyaluronic acid in big volume and big quantity, especially in the breast. It's now forbidden in France since 2011, because you can have, in such case, some, I cannot remember, some perforation and also fistulization from the mamma. Even there are some cases which has led to bilateral mastectomy with hyaluronic acid in the breast. And who is doing hyaluronic acid in the breast? are mostly not plastic surgeons because, of course, they can only inject and they don't know how to make implants, and that's why they are really quite dangerous. So that's why I would never do anything in the breast. And also now about the fat, which is the safest filler. If it's, of course, your own fat, it can happen sometimes granulomas, but only if you have a parodontosis or dental focus. That's why you always need to make an oral examination before you make your lipofilling or your fat grafting, especially in the face. About polylactic acid, like all of them, you can have nodules and granulomas. That's for polylactic acid. It's not so safe as you could imagine. You see granuloma. Here, infected granuloma with polylactic acid. And normally, if you make, like I told you, some ultrasonography, 20 megahertz, to follow your patients, or before you make a filler to your patient to see if he had anciently something, or if he has a granuloma that you cannot see clinically, to not be responsible, you should always do that. You can see, for example, a granuloma from polylactic acid is situated here really under the epidermis, in the dermis, without anfractuosity. That is really typical for polylactic acid. When you see a really ultrasonography 20 megahertz with a granuloma, you can associate it to etiology to know if it's polylactic acid, if it's silicone, if it is something else. You will see that during my presentation. There is something not good with iCloud. Just a moment. So, now let's check calcium hydroxyapatite. So, always the same problems. And silicone has been the first filler of the world, because when we had nothing before, like in 1975, a lot of Thai people used it to put specially also in the butts. And you see, in such case, the granuloma was only treated not medically but surgically, leaving, of course, a scar. And it doesn't mean that when you treat a granuloma surgically, that it will not reappear again after surgery. So it's a nightmare, non-stop nightmare. Here it's a Thai boy. He wanted to be transsexual and female instead of making 11 operations to transform his face from boy to girl. He has transformed him in a monster with, of course, non-stop complications. Like you can see here, I have seen this kind of monster in Thailand. And like you can see, the silicone granuloma, at the difference of polylactic granuloma, are very, very deep situated. And mostly, they have no evolution. I would say myself, I prefer one silicone granuloma instead of a polylactic granuloma, because if it stays there and you don't touch, mostly it's okay. But you have not to touch. A polylactic, you can destroy anything. That's why you have also to be careful. But that's, of course, silicone too. That's transsexual inject them silicones between themselves, of course, not the doctor, and you can find such kind of problems. Now let's go to acrylates. And acrylates, you can have many, many complications like migration, gelioma, inflammation, prononecrotic process, trophic disturbances of tissues, aesthetic problem, and the worst is the impossibility of the completely gel removal. I show you. Here it's my own classification because I am also doctor in chemistry. And what are the risk factors of acrylates? First, when you have a hydrogel. What means hydrogel? Hydrogel, you take, for example, a contact lens, you put some water, then you will have some expansion. That's a hydrogel. But if here you have no expansion with water, it's not a hydrogel. Of course, the hydrogel are very, very dangerous because you change the chemical structure, which will be very not difficult to break the polymers into monomers, and the monomers will migrate. So that was one from China, which is actually still on the market in Venezuela and has been forbidden by China's government, which is quite good. And it was even injected on the breast in China. And all of the women who get that have got bilateral mastectomy. And here it is on the face, you see, even for granuloma with surgery, but you had nothing else to do, and you have always to repeat. And this kind of hydrogel lead to geleoma. The term geleoma comes from Russia. It means a tumor with gel. And if you inject it in the cuff, for example, you will get some kind of geleoma. But, of course, some stupid people inject that hydrogel in the mammary glands, and you can see what will happen 5 years after the polyacrylamide gel hydrogel. Of course, you can see the geleoma when you make the operation. You can see here by even ultrasonographic or MRI, and you can see here during the operation this kind of geleoma. Here's a geleoma, and you cannot say that it's really a good capsule because a histological capsule has nothing to do with anatomic capsule. Anything can go through and migrate with histologic capsula like that. The second risk factors are the presence of monomers. What means monomers? Here, suppose it's a glass. It's like polymer. If I break it, it will be little pieces like monomers. Suppose this is a prosthesis that I put under my mamma, and suddenly it breaks. The little pieces will migrate, even in the blood. And when they are in the blood, the little pieces, of course, they can go to the heart and make a necrosis of your heart as well. So that are the biggest problem because they migrate anywhere. And of course, when the companies are selling that, they say, it's a polymer. You have always to ask, but how much monomers have you? And that are the problems, the monomers like that. But the companies who sell that will say monomers it's like the unit PPS or something like that, which means that you see the monomers under microscope, then you can tell anything you want. It depends on the human eye, so it's like a lie. The unique method to detect monomers is a spectrophotometry at 220 nanometers. If you have a pike, it means you have this presence of monomers, and it means you will have a very dangerous product with monomers which will migrate. That's the only way, and it's very easy to find. So because of monomers, you have this kind of migration. And, for example, there are some products on the market in Europe which are called endoprosthesis because it means they are normally surrounded by a capsula and you will have no migration. Of course, they use the ultrasonography 7.5 megahertz just to sell it. But if you check at 20 megahertz, you will see no more capsula. In reality, what was looking like capsula, it was only referential structures like some kind of fibroblast, which are convergent, but which not stop the migrations. That's why you cannot say it is endoprosthesis. And because of this migration of monomers, you can see what will happen after, even 3 years after, even 5 years after. You inject it here in the butts, and you can see the effect of the migration, even in the mamma. And like you say, the fibrous capsula is not anatomic capsula. That's why you have such kind of problems. And you see here still the migration there, like here. So, the third point is the presence of heavy metallic ions. It's almost don't exist anymore. There was only one filler who had that, Argiform, which was silver plus the rest of acrylates and provoke granulomas because of metallic ions. The fourth risk factor is the presence of biofilm. We all know what is biofilm. And of course, with biofilm, you can have such kind of infection, especially of the people who have HIV positive and many kind of problems. You can have also purulonecrotic processes, like you can see here, with some necrosis. You can see here too, this purulonecrotic process. And you see with a purulent mastitis, she needed 4 surgical procedures and maybe more after. That's just at this moment to show to you it's really a nightmare. Never inject any kind of filler in the penis, especially who ask penis injection mostly. I am not a specialist of that, are the mafiosi. And if the mafiosi has necrosis of his penis, he will kill you. So in such case, be careful. It's better not to do. Just for only big specialists that I know. Here again, you see purulonecrotic abscess. Here another purulonecrotic abscess. And also now we are at the 6th factor of complications. It's a hydrolysis. The hydrolysis appear a lot with this kind of acrylates, and it looks like wet sugar when you just make the palpation and you have to take off the material which has been metabolized. The mixed biphasic ones are the worst of the worst because, like I told before, never mix fillers in the same area, but here they are mixed by chemistry. And it's the people who will sell to you hyaluronic acid with longer duration or collagen with longer duration. And to have the longer duration, they will add the methylacrylate to hyaluronic acid or to collagen. So here, the methacrylate itself can give, of course, infection, granulomas, necrosis, or also edema, such kind of things. But when you mixed them, then you will have such kind also of problems, and even here it's hyaluronic acid plus polymethacrylate. Even if you treat them with corticoids and antimitotics, it will resolve absolutely nothing, because what will happen, the granuloma and the treatment continue to attack the whole dermis and the whole epidermis, and you will get really a big extensive necrosis. That is really the biggest problem you cannot imagine. So normally it's better to make surgery, but it doesn't mean that it will resolve all your problems. You see, even here, 11 years after collagen plus acrylate, and it was FDA-approved product, maybe still now with another name. So that's what I wanted to show you. And of course, the worst also is when you don't sterilize your acrylate by gamma rays, when you use ethylene oxide, because it makes that the molecule is not stable and will break much more easily, and that is a problem. So, how now to correct such complication? You can try to remove the gel, but it will be impossible to remove it completely. You remove what you can and you put a prosthesis, or you need a second removal and you correct it. That are proposals. Here for the gel removal, it's quite easy normally. And you see before operation, 2 months after replacement. Here 2 years after gel removal, but you still have some gel remaining. It means that is really the main problem. And here, 1 stage removal, you put a prosthesis, but what will happen after? Even you can be maybe happy during 4 years, but you will see that, you see here, after something always will you still remain, and what will happen is that it will make also a problem for the operation you have done. Of course, the patient will be happy during maybe 4 years, and again after, it's a nightmare for the patient. And you can see when you reopen the patient, you still have some gel in the capsule cavity. Here it's some pictures to finish of Professor Luis Toledo, who is a very good friend of us and also of Angelo. He was ex-president of Brazilian Society of Plastic Surgery, and actually he is an ISAPS professor in Dubai. He gave me his pictures too, to show me the necrosis after removal of such kind of gel, like you can see here. So, as conclusion, I have shown you some products which are on the market and who are CE, which are C and FDA approved. So for me, this kind of bodies doesn't mean that a product is safe. Mostly they are like CE corrupted, and I know that even in Switzerland. So who should decide to put a product on the market? Should be only the doctors. Like in Japan. In Japan, you don't need any approval to put a product on the market. Any doctor can import what he wants. But during 2 years, the government health ministry is catching all problems of the product, and if there are too many problems, they will then forbid the product on the market. So I think Japan is a very, very good solution, and they are much more intelligent than our corrupted authorities. Thank you for your audience.